My name is Tony Abuta, Director of Amsha Africa Foundation, and today we are at Lema, about 120 kilometers away from the city of Nairobi, Kenya. We have the pleasure of coming here to do eyeglass distribution, and we have a lot of locals who've walked for miles to come here to get checked by our partners NeoVision from Nairobi. They'll do extensive checks and refer them for further checks if they have issues with their eyes. And then some of them, we've provided them reading glasses, which came all the way from the US in partnership with Eyes on Africa, who've been our partners for a long time. And we're so glad to have that partnership with them and impact rural communities like here in Lema. Eyeglass distribution is one of our programs with Amsha Africa Foundation. If you think about it, there's so many people even in rural Africa who have cell phones. A lot of old people who depend on cell phones. And there's been an issue with getting quality eye care, right? And if you think about holding a cell phone and looking at the small text on the cell phones, you know, there's so many people over here who have eye diseases that impact their eyes, that make them degenerate, and they really don't have clinics that look at their eyes. So bringing in an eyeglass distribution, an eyeglass check, opticians to remote areas is very critical to help these communities in remote villages access that quality eye care. And we've had so many communities ask us for these types of services. We know that there are governments and local governments who have certain services, but with partnerships with some of our organizations in the United States and here, we think we have a better impact in talking to chiefs and local elders. And having done this in multiple locations, we get very good feedback, and we also get a lot of requests to come to these remote areas that even the local governments cannot come. So I think with our partnerships with the local communities, with the local elders, and also with our expertise in-house, and also with our partnership with opticians, I think we are seeing amazing impact. And we want to extend this to other locations, not only in Kenya, but East Africa and the rest of Africa and global South countries that we're working with. And the beauty about this, it's a very low hanging fruit. Getting the eyeglasses from America, our partners in America, Eyes on Africa and Restore Vision, shipping them over here. We have so many people on the ground that can mobilize communities like we are seeing over here in Lema. And it's just amazing to just see the impact, especially with the elderly people who, once they put on their glasses, and for the first time or in a long time, they can see it. They can see their cell phones properly, and they cannot squint, and they cannot ask their grandchildren or kids to look at cell phones or read newspapers or any other magazines. So I think it's near and dear to my heart and my organization to really, really help the underrepresented, the underprivileged communities in an area like this in Maasai land. So I'm very grateful for this opportunity and to make that impact.
My name is Rita Wangwe. I'm the founder of NeoVision Eyecare. And today we are here at Isinya with Amsha Africa Foundation. We've been invited to do a free camp so that we can touch lives and distribute glasses to the less fortunate and the needy here. And we are excited about it because changing lives is part and parcel of what we do. So we are excited for the opportunity, and we love being here and changing lives. So as you can see, we've been able to do the refractive error and also be able to know which people need surgeries, which one needs glasses, and be able to assist them in the best way that we can be able to do. So we've done the refraction. We also had another unit over there that we were doing the refractive and seeing how far can, the client see. And yeah, I feel like we have been able to see most of the things that we would really have wanted to see. So at NeoVision Eyecare, we are optometrists, plus we have an ophthalmologist. So when you come to our clinic, we get to give you glasses in 45 minutes. So meaning that we don't have to come after 3 days to get your glasses. So it's immediate. 30-minute service and you're out of there with glasses.
Sasa hapa tuko na mzee Paul hapa kutoka hapa Lema, si ndio? And I want him to say a few words about this eyeglass distribution vile inawasaidia.
Glass ni nzuri. People have problem of eyes. Some have cataracts, have been removed. Others not yet removed. So they can be given some medicines for their eyes. Glasses are nice for readings. Glasses you can read the Bible, can read the phone, something of the sort of things. I think the situation is good for us, for our environment, for our people. I think this is a good assignment for our people. If you have a problem of macho, we should travel up to Kajiado, Viparo, or Kitengela. But if your company came near to us, it is easier to approach or to go there where the doctors are.
The doctors are.
Yeah.
And this is what we're doing. We're bringing the doctors to you to help you, so you don't have to travel so far to Kajiado, to Kitengela, and also to refer you to better care. Come on up, you have some eye issues, they refer you to a better care. We've been discussing what our organization, Amsha Africa Foundation, can help him and his community. And he's been talking about healthcare issues. So Mzee Paul, what are the main healthcare problems that your community sees?
It's malaria, ammonia,
pneumonia,
and eye issues like
cataracts, yeah.
Something of the sort of things. Homa.
Yep.
Cold homa.
Yeah.
So we need a facility here.
Yeah,
a facility. Healthcare facility.
Yeah. Doctors.
Yeah. And doctors.
Yeah, and doctors. Yeah. And that's something that we'll work to make sure that work with the local government, county government, to make sure that we can have one here.
That's good.
Yeah. So, thank you so much, Mzee.
Thank
Good to see you.
Thank you.
And so glad to help you with your eyeglasses.
Thank you.
Yeah, thank you so much.
Langu la kwanza ni kushukuru Mungu kwa sababu ya siku hii ya leo. Tumeona wageni wetu wamekuja. Tunashukuru Mungu kwa yote. Kwa sababu mimi nilikuwa naumwa na macho, lakini leo tunashukuru Mungu nimepata miwani. Nilikuwa sioni kwa jicho moja, lakini nimepata miwani, saa hii niko sawa. Na tunashukuru wageni wetu kwa sababu wamekuja kutusaidia sana. Tunawakaribisha tena kwa sababu ni wengi wako na shida, matatizo ya macho. Kuna wale wanasoma, kuna wale wanashona ushanga, wengi hawaoni. Kwa hivyo wanahitaji sana miwani. Kwa hivyo tunawakaribisha tena na tena. Mkubwa wetu, nataka kukushukuru sana. Hii ni neema ya Mungu kupata watu kama nyinyi. Pesa hatulipi. Mimi kwanza nilianza Kikuyu nikafanyiwa operation, nililipa pesa mingi, lakini kwa sasa nashukuru Mungu hakuna kitu nimelipa na nimepata miwani. Nikitaka kusoma Biblia ninasoma vizuri, nikitaka kushona ushanga ninaona. Kwa hivyo tunakubariki sana, Mungu akubariki.
Asante sana. Tumeshukuru sana kuja hapa kuwasaidia.
Asante.
Sasa tutafanya hii siku nyingine ambao wale watu wote ambao wakuja leo wakuje.
Karibuni kabisa. Asante.
Asanteni sana.
As the day drew to a close, our hearts were full, knowing that we had made a difference in the lives of many. Despite the many challenges we faced, from heavy rains to impassable roads, nothing could dampen our spirits. We work tirelessly, providing assistance to those in need, offering hope through clearer vision, but amidst the hustle and bustle, something magical happened. As the rain subsided, a beautiful rainbow graced the sky, reminding us that even in the midst of challenges, there is a beauty to be found. Until next time, let's continue spreading kindness and making a difference one pair of glasses at a time. We would like to thank our partners NeoVision and Eyes on Africa for making this day a success. Thank you for joining us on this journey.